Hello, everyone. My name is Adeswa Abasahin Watson, and I'm the Director of the Suffolk County Department of Health Services Office of Minority Health and the Chair of the Suffolk County Multicultural Advisory Committee.
So in conclusion, I want to just go over a couple of different OASAS resources to help you find or access treatment services. You can always go to New York State OASAS Treatment Availability Dashboard, which is our findaddictiontreatment.ny.gov. Another aspect is the New York State Hope Line, 1-877-846-7369, or text HOPE-NY to 467-369. We also have our CHAMP line, which is our Community Health Access to Addiction and Mental Health Care Project. That helpline is 888-164-5400, or OASAS Patient Advocacy Services at 1-800-553-5790. You can also, again, look at our general website, which is oasas.ny.gov. That is oasas.ny.gov. Our link to prevention, Talk to Prevention website. We also have a combat heroin website that you can access. Information on the Good Samaritan law could be located online as well, and our OASAS provider directory online as well. Finally, if ever any other questions, anything else arises, or if you need difficulty accessing the above information, you can always contact the OASAS Long Island Regional Office, and we will be happy to assist. We can be reached at 631-434-7263. So first, I want to start with how to access treatment. And there's 3 different ways that we have listed through OASAS to easily access available services and get connected to those services. First one being our 24-hour Hope line, which is 1-800-8-HOPE-NY. We also have the ability for you to text a request to that line at 467-369. Another aspect, another way to access and identify services is our findaddictiontreatment.ny.gov website. This site offers available beds in inpatient services, as well as a listing of all outpatient services, other residential services, detoxification programs, which we'll get more into defining what those services actually are in a little bit. Lastly is our main website, which is OASAS, oasas.ny.gov. And on our site, you can find a full listing of all treatment services by county, by zip code, by town. The search options is very detailed to help really define where you're looking for and what type of service you're looking for. Okay. Talking about treatment is one thing, but we also got to look at prevention, treatment, and recovery all together, because it's a continuum of care. Looking at, prevention, addiction prevention in New York State is based on a risk and preventative factor framework. Preventative factors for children and youth and adults are included: open communication with family members, teachers, other adults in their lives, a strong sense of family, positive experiences and role models, and attitudes and conditions in their community. We have a recovery-oriented approach to treatment where we're really meeting the needs of all New Yorkers. New York State's approach to addiction treatment is person-centered and completely individualized. It's really about meeting the person where they're at and providing the services that they are actually looking for. As a side note, OASAS directly operates 12 addiction treatment centers, and we oversee over 1,600 treatment programs throughout the state. There's other aspect at the very end of treatment is recovery, and understanding recovery is a concept that a lot of people are focusing on at this point, because recovery is a continual process. We have individuals in recovery, which is where we are, in the recovery process, and OASAS has information and resources and supports to help anybody who's looking to join that journey or continue on that journey. There's also resources for family members and loved ones of somebody who might be using a substance. The disease of substance use doesn't just impact the individual using the substance, it impacts everybody connected to them, family members and loved ones. Some of the services we include is overdose prevention. This is looking at naloxone. Naloxone is a drug that will actually reverse somebody who's in an overdose. Access and education to naloxone should be provided to all patients and clients and families, and anyone utilizing an illicit substance. Any treatment provider can help connect an individual with these services, these training, and to help obtain the medication. Just, as a side note too, there is the Good Samaritan law that protects any individual who administers naloxone to somebody who appears to be in an overdose, an opiate-based overdose. Looking at continuum of care. So behavioral health model continuum of care. This is just a quick glimpse as to what we are looking at through the entire process of recovery. Looking at starting from promotion, going into prevention to treatment, and then the actual recovery process, which is continual. We'll get into this in the next slide a little more detailed. So promotion looks at strategies designed to create environments, conditions that support healthy behaviors and one's ability to withstand challenges. Prevention, delivered prior to the onset, interventions intended to prevent or reduce the risk of engaging in unhealthy behaviors. Historically, prevention was focused on adolescents, young adults, children. We have taken the prevention and taken across the span of life, working with adults as well at this point. Treatment, services provided for individuals diagnosed with a substance use or other behavioral health disorder. And then we get into recovery, which are services to support individuals' abilities to live productive lives in the community. Again, recovery is an ongoing process that continues throughout the person's life. Okay. More information on prevention. Prevention comes in different levels and different categories is what's looked at. Our prevention programs use what's called evidence-based programs and/or practices. These are educational curriculum offered to youth, parents, special populations, or community members. Environmental strategies are provided in the community, often led by youth and driven by youth. These are activities and campaigns to help get the message across about possibly drinking and driving. These are campaigns focused to help prevent substance use. Early interventions for substance users, screening tools to determine early risk. Another aspect of prevention is prevention counseling. These are brief counseling and interventions to prevent, delay, or reduce substance use, problem gambling, or the negative consequences caused by these behaviors. This includes screening and assessment and referral for individuals to the appropriate treatment or support services. Community coalitions, another aspect of prevention. They engage in environmental strategies to change community-wide norms and policies. They focus on shifting the substance use culture in a community towards healthier norms and expectations. Locally, we have the Long Island Prevention Resource Center, which is located in Bayshore, and their website is listed on the screen. It's www.liprc.org. And lastly, we have problem gambling resources, and we have the Long Island Problem Gambling Resource Center, whose website is also listed on the screen. Okay. Another screenshot that's really helping explain the continuum of treatment services. So if we look at this image, we're going from the red end on the left, where we're talking about medically managed services, which is an inpatient, usually detoxification program, typically a hospital-based, and going down to the lesser of our services on the other end, which is outpatient, and everything in between, which is talking about inpatient rehabilitation, stabilization, residential services, rehabilitation services, which again, we're going to get into more detail in a few moments on those services. Types of treatment services. These are some of the terms you may hear or when you're seeking services either for yourself or a loved one. Detoxification programs, inpatient rehabilitation programs, residential treatment programs, opioid treatment programs or OTPs. We currently have 4 clinic sites in Suffolk County, outpatient rehabilitation programs and outpatient clinics. So looking at detoxification program, this is a program that is an inpatient-based setting where somebody is being medically managed to come down from a substance to avoid any medical complications. Inpatient rehabilitation programs, traditionally looked at as 28-day programs. This is another inpatient setting that it can last anywhere up to 28 days. It can be 7 days. It's all based on utilization and the services that are assessed and needed for the individual patient. Residential treatment programs. These are typically longer term meaning 30 days or longer, inpatient residential services where all treatment and counseling services are inclusive of that program. Opioid treatment programs are traditionally, a program that is focused on medication-assisted treatment, which is currently being looked at as methadone, buprenorphine, Suboxone, Vivitrol. There's a lot of different medications that can be accessed through these programs. Outpatient rehabilitation programs are outpatient programs that are focused on 2 to 5 hours of treatment per day. It's a higher level outpatient setting. And then we have our traditional outpatient clinics, which are what most people are more familiar with, where an individual goes to a treatment program, they're assessed, and they are recommended for different level outpatient groups or individual counseling services. Some more information, medication-assisted treatment, or MAT. Integration of MAT is in all treatment settings. Access to MAT must be offered to clients regardless of the client ability or willingness to engage in psychosocial treatment. Psychosocial treatment referring to group counseling, individual counseling sessions. And stabilization really is about ensuring patient comfort as they are withdrawing from a substance or removing an illicit substance from their system. So research shows that combining treatment medications where available with behavioral health therapy is the best way to ensure success for most patients. Treatment approaches must be tailored to address each patient's substance use patterns and substance-related medical, psychiatric, and social problems. Medication-assisted treatment works. Medication-assisted recovery is another option. Newer program that has started in Suffolk County in the last couple of years is what we call a DASH program. It's the Diagnostic Assessment Stabilization Hub. And this is operated by Family Service League in Hauppauge. It's at 90 Adams Avenue. Target population is age 5 and over with a primary behavioral health disorder. The services they offer are 24/7, 365 day per year crisis stabilization and open access center. Voluntary program for individuals in crisis situations who feel overwhelmed due to a substance use disorder, mental health symptoms, or other life stressors. If there's a situation where somebody feels like they are in a crisis, they don't have full control, they're concerned about themselves, they can go to DASH, receive an assessment and an evaluation, and be referred to proper level of care or certain interventions. They also at the DASH have the mental health and substance use mobile crisis teams. These are teams of licensed professional experts who will come into the community to conduct an assessment, develop a safety plan, and if necessary, recommend outpatient services or another higher level of care. Again, DASH is open 24/7, 365 days a year. They are located at 90 Adams Avenue in Hauppauge. Center for Treatment Innovation are CODI teams. CODI teams are OASAS treatment providers focused on engaging people in their communities by offering mobile clinical services, as well as linking people to other appropriate levels of care. CODIs target under or underserved areas and expand access to telepractice, substance use treatment services, including linkage to medication-assisted treatment, as well as peer outreach and engagement within the community. CODI can be reached 24/7 at the DASH hotline, which is 631-952-3333. Detoxification services, we covered this a little bit earlier. So detoxification or withdrawal and stabilization services manage the treatment of alcohol and or substance withdrawal, as well as acute disorders associated with alcohol and or substance use, resulting in a referral for continued care. Throughout the continuum of treatment, People can receive services for mild to moderate withdrawal through MAT. And again, you can access these services or find how to access these services at our addictiontreatment.ny.gov website or Suffolk County Behavioral Health Directory. Their URL is listed below, is another directory of all services located in Suffolk County. Residential services. We have two levels of residential services, our 819 programs and our 820 programs. So looking at 819, it's an intensive residential service. Persons unable to comply with treatment outside of a 24-hour setting, as evidenced by recent unsuccessful attempts at abstinence or prior treatment episodes, or somebody that might qualify for this level of care. It's all services are based under the same roof. Clinical services, life skills, vocational services, all within one setting. Another level of that is what's called a community residential service. And this is for persons who are homeless, whose living environment is not conducive to recovery and maintaining abstinence while residents are concurrently enrolled in an outpatient chemical dependency program for substance use treatment. This is a lower level. People reside here. They do get some life skills, vocational services, as well as attending, again, treatment at a separate outpatient program. Other side of that is our 820 programs, which are another aspect of residential services. They are OASAS certified programs that provide medical and clinical services, nourishing meals, limited transportation, support groups, and referrals. This service, again, is at 3 different levels. We have a stabilization level, which is for somebody who is enduring mild to moderate withdrawal symptoms. So their withdrawal symptoms can be managed within this residential setting. They receive counseling, group services, individual counseling as well. Next level, which would be a step down from stabilization, is our rehabilitation. This is equivalent to similar to the intensive residential services, where all clinical behavioral services are provided on site where the resident is living. And the last phase, which is a step down, which is reintegration services, which is where the individual is still residing in the residential setting, but has gotten to a point where they might be receiving external services. They might be looking to go to work, back to work, and start, getting, building up bank accounts and, reintegrating back into society out of the residential setting. Another aspect of our residential services is our residential rehabilitation services for youth. These are short and long-term inpatient programs for youth with substance use and co-occurring disorders. These programs have an enhanced staffing pattern that better meets the developmental needs of adolescents. This level of care can accommodate adolescents under the age of 21. Outreach Development Corp, located in Brentwood, is our local provider, and they treat individuals between the ages of 13 and 18 years of age. Women with children in substance use treatments. So we have a couple different levels of care for women and their children. So we have residential and rehabilitation reintegration services are available to support the unique needs of women, pregnant women, and/or parenting. We have an outpatient day treatment program that accommodates space for women for their children while the women are engaged in services. So we have SCO Family of Services, Madonna Heights, located in Dix Hills. That is a residential program that offers residential services for women and then has a separate section for residential services for women and up to 2 children. Then we have Outreach Development Corp. They have a day rehabilitation program located in Bellport, which offers services to women and a daycare so their children can be taken care of while the mothers are actually receiving their clinical services. And they do have a women's residential program located in Brentwood. Outpatient substance use disorder services. So OASAS certifies outpatient services with a multidisciplinary team approach, which includes medical staff and physicians who serve as their medical directors. These programs provide services to individuals who suffer from substance use disorders and their family members and/or significant others. Some of our services offer specialized programming, such as intensive outpatient treatment, adolescent, women, and/or family services. Again, more information on our opioid treatment programs located here in Suffolk County. Our opioid treatment programs, or OTPs as we refer to them, are OASAS certified sites where medication to treat opioid use disorder is administered. Medication, again, could be methadone, buprenorphine, or Suboxone. These facilities also offer counseling and educational services. Most cases, patients receiving services at an OTP clinic are provided treatment over a lifetime, similar to managing a chronic physical ailments. We currently have clinics that are located in Huntington, Riverhead, and there's 2 locations within Hauppauge. Typical intake sites for the Suffolk County OTP programs are their Hauppauge location, and on the east end, the Riverhead location. Recovery support services on Long Island. This is a newer initiative that is really taking ground and adding a great aspect to the services that we offer to the clientele that we work with. So the first one is the peer engagement specialist services. So peer engagements use their lived experience to engage people on the street in emergency rooms, developing a person-centered service plan, providing referrals, and linking to needed services. The PES, as we call them, the peer engagement specialists, provide support, encouragement, and guidance in linking persons to appropriate services. They are particularly effective with people who have been reluctant to participate in traditional behavioral health services. They are made available in all of our OASAS treatment settings. Another aspect of those peer services is our family support navigators. So these are individuals that are taking their experience as a family member of somebody who was experiencing a substance use disorder and going through the recovery process, and now working with other family members or loved ones. So the primary goal of a family support navigator is to assist families and individuals with gaining an increased understanding of the progression of addiction and how to navigate insurance and treatment systems. They also develop relationships with local substance use prevention, treatment and recovery services, managed care organizations, area substance use disorder councils, and community stakeholders to assist families with assisting treatment and support services. Suffolk County has a program called Thomas's Hope Foundation. They are a strictly peer program that offer peer support services as well as family navigator support services. Other recovery support services on Long Island. We actually have in Suffolk County 2 recovery centers. We have Thrive Recovery Center in Hauppauge and a newly opened Thrive on the East End in West Hampton Beach. Thrive stands for Transformation, Healing, Recovery, Inspiration, Validation, and Empowerment. The center provides health, wellness, and other critical supports to people and families who are recovering from a substance use disorder or are seeking recovery services for a family member or friend. They provide a community-based, non-clinical setting that is safe, welcoming, and substance-free for any member of the community. They promote long-term recovery through skill building, recreation, employment, readiness, and the opportunity to connect community services and peers facing similar challenges. Another aspect of recovery services is our Long Island Addiction Resource Center, or as we call it, our LI-ARC. They target community members, addiction disorder field professionals, and substance use disorder field professionals. They offer virtual, easy-to-use access to invaluable information about providers of education, prevention, treatment, and recovery services in Nassau and Suffolk counties. They are also able to provide mini grants to support community awareness programs. Again, the website is listed below, the Long Island Addiction Resource Center.org. They have a resource guide that will advise of all behavioral health services and providers located within the Long Island region. Problem Gambling Resource Center offers services that assist individuals who are affected by problem and pathological gambling, including family members and/or significant others. They provide group and individual counseling, education, orientation to and opportunities to participate in problem gambling awareness and relapse prevention, as well as self-help groups and family treatments. In addition, they are able to help connect people to financial counseling, either directly or through outside referrals. We have our CHAMP line. You can also contact OASAS Patient Advocacy at 1-800-553